quorum and it is 1:30, so you are free to start whenever you wish.
All right, then. I think well, Katie, were we expecting a couple more members? I know Tad can't make it today, and I know that Marshall's going to be a little bit delayed. Were there other members that we were waiting for?
They all just joined, so I think you're good to go.
Well, perfect. Oh, hi, Chris. Hi, Charles. All right, we are going to go ahead and get started then. So good afternoon, everybody. With the quorum present, the Maricopa Regional Continuum of Care Board meeting is now called to order. A few housekeeping announcements. Please remember to mute when you're not speaking to create a positive environment for everyone. Members attending by phone only, please remember to press *6 to mute and unmute and *9 to raise your hand. Before we continue, Katie, I'd ask you to proceed with the roll call. Please indicate you are here and the organization that you are with after Katie calls your name.
Chair Ryan Balch.
Hi, everybody. Ryan Balch, City of Chandler.
Eric Cole.
Hi, Eric Cole from ASU.
Elizabeth DaCosta.
Hello, Liz DaCosta with Community Bridges.
Marshall Franklin. I don't think she's joined us yet. Tad Gary isn't present today. Chris Hallett.
Hi, Chris Hallett, City of Peoria.
Joan Service.
Hi, Joan Service, Arizona Housing Coalition.
Charles Sullivan.
Charles Sullivan, ABC Housing.
Jackie Taylor.
Save the family.
Ryan, back to you.
All right, thanks everyone. The next item on the agenda is a call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. In addition, members of the public were given the opportunity to join the Zoom meeting either by requesting the link from MAG staff or by registering on the Continuum of Care Board meeting event page. If you are wishing to make a comment, please raise your hand in Zoom and you will be invited to unmute at that time. Public comments are limited to 3 minutes. If you are having any technical difficulties, please email Katie Gentry at kgentry, Gentry, at azmag.gov. MAG staff, were there any comments received or anyone who has joined the call to offer comments at this time?
No, there were no public comments received and no members of the audience have raised their hand at this time. Thanks.
Okay,
Madam Chair.
thank you, Katie. We will move on to the next agenda item. Our next item is approval of the October 25th, 2021 meeting minutes. Does any member of the board have questions or comments on the minutes? All right, hearing none, could I have a motion to approve the October 25th, 2021 Maricopa Regional Continuum of Care Board meeting minutes?
So moved. Jackie Taylor.
Thank you, Jackie.
Second, Chris.
Thank you, Chris. So we have a motion from Jackie and a second from Chris. Is there discussion of this motion? All right, hearing none, I will ask MAG staff to proceed with a roll call vote. Please indicate clearly how you would like to vote, saying yay or nay after your name is called.
Chair Ryan Balch.
Yay.
Eric Cole.
Aye.
Elizabeth DaCosta.
Yay.
Marshall Franklin. Tad Gary. Chris Hallett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
Jackie Taylor.
Aye.
The motion passes unanimously.
All right, thank you, Katie. Thank you, board members. We will now move on to the next agenda item. We have moved our updates section to the beginning of the agenda, and we have asked any subcommittee members that have recent activity to share with us to present. We will start today with hearing from ESG Subcommittee Chair Rachel Milne, who is the Assistant Director with Maricopa County. Rachel.
Hi, can you hear me?
Sure can.
Sorry,
Welcome.
I'm having issues with my camera. Thanks for having me today. Wanted to let you know that the ESG subcommittee was very, very busy in the 2020. We were actually meeting every other week to coordinate all of our ESG CV round 1 and ESG CV round 2 funds regionally. So making sure we all were aware of what we were doing and helping each other out with all of the new rules and regulations that HUD put on those funding sources and the reporting requirements. So now that we are sort of set with those funds that expire September of 2022, we've moved on to a more regular monthly meeting schedule. So we're meeting monthly, and really this next meeting, which is on Wednesday, our December meeting, we're going to be looking at the ESG charter language and really trying to look at that old language from about 5 years ago and cut out some of the things that are not applicable and really beef it up with some actionable items. So looking for a really robust discussion. Katie Gentry has done research on other continuums and how their language specifically for ESG or finance subcommittees. So we're stealing from some good ones and also utilizing what we know to be the needs here for the ESG in the Maricopa region. So lots to come in the next few months.
Awesome. Thanks, Rachel. And before I ask board members if there's any questions or comments, Rachel, would you just mind, for anyone who may be watching today, just describing what ESG is and what the purpose of your subcommittee is?
Oh, sure. So the ESG subcommittee is made up of all of the HUD grantees in the region who get emergency solution grants directly from HUD. So that is Maricopa County, DES, City of Phoenix, City of Mesa, City of Glendale, and City of Tempe. So the subcommittee is made up of one representative from each of those communities to discuss their ESG funds and to align. We are required to align our ESG funds and consult with the COC in order to receive those funds directly from HUD every year. The committee has spent a lot of time talking about aligning scopes of work with our ESG funds, aligning monitoring documents. So that's really what we're going to be working on in the coming months is figuring out a plan to do so. And then just so for everyone's knowledge, ESG funds can be used to fund things that the COC can't directly. Most importantly, shelter. So you can use ESG to fund shelter, street outreach, rapid rehousing, and HMIS.
And can you also still use ESG for prevention, Rachel?
Oh, sorry, prevention too. Yeah, we
Okay.
just don't at the county, but that's an eligible activity.
Yep. Thank you so much. I think that's really helpful. Just for everyone who might be new to this, or just as a reminder, I really appreciate that. Any questions or comments from board members or audience members? Well, Rachel, I really appreciate your ongoing leadership of this committee. I come from back in a time when I don't think HUD required it, and it just wasn't a thing that all of the recipients of ESG coordinate together to, provide the best possible service across the valley, and also to make it easier on people who are using ESG funds, providers, to see the same reports and the same requests and things like that. So I really appreciate your leadership in this area. Keep up the good work.
Thanks, Brian.
All right, thanks, Rachel. Next, we are going to hear an update from Katie Gentry, Maricopa Association of Governments, on the committee, as well as the Rank and Review Subcommittee and scorecard. Katie.
Thanks, Ryan. Michelle wasn't able to be here, but wanted to share with you all that the committee extended invitations to 10 individuals for membership. So I'll run through their names really quickly. John Bogart with Homeless Youth Connection, Melody Boyer with the Phoenix VA, Sylvia Chavez with the Department of Education, Allison Cook Davis with ASU's Morrison Institute, Jessica Cruz with Housing Authority of Maricopa County, Marcy McFarland with Home Inc., Jim McPherson with Phoenix Community Alliance, Laura Scott Nicky with Salvation Army, Michelle Stokes with Behold Charities, and Jocelyn Wilkinson with Department of Veterans Services. And then they also elected 2 new co-chairs, Wendy Johnson and Richard Cruz. So I'll pause there if there's any questions about that.
Okay, congratulations to, was it Wendy and Richard?
Yep.
Yep, congratulations to Wendy and Richard. We appreciate you taking over this. This is a very important group and committee that does a lot of work for our Continuum. So thank you for taking that role, and thank you also to the outgoing chairs for all the work that you have done. And that is a really broad new amount of membership. So congrats on making all of those decisions. That will be awesome to start to hear from all of these new individuals. Questions, comments from anyone else? Okay.
And then the second update is specifically around the rank and review. We will be doing a debrief from the NOFO, as well as starting to look at the scorecard for next year. So if anybody on the board is interested in diving deeper into the scorecard and wanting to kind of dissect that and help improve that, reach out to Julie Montoya on our staff, because she will be the one navigating that. She's also off today.
Okay, so you will be doing a debriefing, is that what you said, Katie?
There will be a debrief, and invite will get sent out for that, and then we will also be putting together a work group to specifically look at the scorecard. So both a debrief and scorecard improvement.
Okay, and who gets to participate in the debrief?
Anybody and everybody who would like to listen to how the process went and get any feedback. And if you are an applicant who is looking for feedback, we are happy to meet with you one-on-one as well after the debrief is over.
Yeah, so big shout out to providers or applicants. This would be a great time to learn more about what goes into that scorecard and provide comments about your ability to score well in a certain area, or things that should be considered, because that will go into next year's scorecard. So thank you, Katie. Any other comments, questions? Anybody? I'm not seeing anything. Feel free to shout out people. It's hard to monitor everyone at the same time on a screen. Okay, if nothing else, thank you so much, Katie. Does any other subcommittee or committee have an update for us? Or Joan, do you have a legislative update for us?
Let's see here. So at the federal level, all eyes are on what the Senate is going to be doing to taking up the Build Back Better budget plan. Obviously there's a significant amount of affordable housing investments in the Build Back Better plan, with the House adding the recent strengthening of the federal low-income housing tax credit program, basically inserting the Affordable Housing Credit Improvement Act, something that folks on the call, our state really kind of mobilized and got Senator Sinema and then Senator McSally to support. So the fact that that's included in the current iteration is a good thing, and we're hopeful that the senators will continue to make that a priority. But obviously the clock is ticking. And so we're going to be continuing to push our members of Congress to support that process. At the state level, I think it's the calm before the storm. We've had some preliminary conversations with folks in the governor's office and our friends at the Department of Housing, that there's going to be a significant focus on housing and homelessness going into 2022. And I'm really encouraged to hear that and see that. I attended a meeting last week with Representative Chavez, Representative Cobb, and newly appointed Representative Solario with a significant focus on affordable housing and ending homelessness strategies. So I think there's going to be some good momentum and emphasis. So I encourage everybody, we're going to most likely do a day at the Capitol, provided COVID-19 protocols at this moment in time, they are relaxed down at the state legislature, but that could change. So we're hoping to do a day at the Capitol, which to be determined, but we'll be prioritizing our typical asks of restoring the State Housing Trust Fund, and again, elevating the issues of affordable housing and ending homelessness in some policy priorities. So happy to answer or entertain any questions.
Thank you, Joan. I'm excited that this day has finally come, even though I know it's going to be busy and crazy. It's, long overdue. So hallelujah.
Agreed.
Yeah. Board members. Audience members. You have our state advocate right here at your fingertips. All right, Joan, you must have covered it all. We look forward to hearing more from you about that for sure.
And anybody who's interested in learning more, always just reach out to me. Happy to have people involved.
Thank you, Joan. And you just reach out to us when you need us as well. Does any other board member have any other item for discussion in updates? Okay, I'm still not seeing anyone. So thank you, everyone. We will move on to the next agenda item.
Madam Chair, Jackie,
Yes.
raise your hand.
Oh, perfect. Jackie, my apologies.
Yeah, Madam Chair, if we could go back to membership, I think I missed it. So when do the new terms begin and the old ones? In other words, I was wondering when your chair position ended. I just certainly wanted to thank you, and I wasn't sure about the timing on that issue.
So actually, Jackie, we were talking about the committee, not the
committee.
governing board.
I'm sorry. I thought we were really expanding our governing board.
No, but we are going to talk about board membership later on in the agenda today. So hold your thoughts.
Clarification.
Okay, but I appreciate that. Okay. Let me.
Madam Chair.
Yes.
Hey, it's Eric. Following up on Joan's great report on the legislative work, and this may be something that I just flag for when we talk about the regional plan. And well, I probably shouldn't get ahead of the regional plan, but however, should it get approved and move forward, seems to be a pretty valuable piece of information for the legislature as we're going forward. So I just would put a pin in, what do we have any sort of organized plans or thoughts about how to share that with our state electeds going forward. So we can come back to it when we talk about it though.
Okay. That's a great thought, Eric, and a great question. We will need to definitely be making those plans. And yes, I do.
Right? Yep.
Yeah, I do think that there has been thought around this.
Cool.
Yep.
Thank you.
Okay. Anyone else I missed? Okay.
You are good. I don't see any other hands raised.
Okay, thank you. All right, so on to our next item. TJ Reed, a Regional Homelessness Project Manager at MAG, will provide an update on the Regional Homelessness Action Plan and offer the plan for approval. TJ?
Madam Chair, members of the board, it's good to see all of you today. I'm going to go through a quick presentation for you all, and then we'll have some time for discussion and then action at the end of it. Next slide. So the purpose of this presentation is really for two things. One is to just update you, as you all are, I'm sure, painfully aware of at this point. This is an ongoing update that we've been sharing with the board for the past, I think it's been on every board agenda for the past like 6 meetings or so. And so we've really appreciated your feedback And this is just to make sure you're clear on where we're at. And then secondly is the board to recommend approval of this item. So with that, next slide. And so since May, here's just kind of a recap of where we've been. There's been a regional homelessness coordination team made up of representatives from local and tribal governments who have been meeting since July, really getting in deep with this stuff. We've presented 9 times with the board and the committee. We've been updating MAG's management committee and regional council over the past few months. And then most recently, MAG management committee voted on this, which it did go through in November, which is great. We've also had individual meetings with 27 of our member agencies, and then have had various community partner meetings and surveys and discussions. So this has been a lot of things kind of coming down to a really informed plan that is made for and by those that are really going to be implementing this. Next slide. And so I'm just going to briefly go through these. I'm not going to go through them in detail because I know we did that last time and the time before. Similar to last time, I've just highlighted the ones that this board will have a particular role in as we go forward, just to make sure we're all clear there. And so the first category is really committing to the work regionally, where we're really focused on ensuring together we're doing this, right? Local tribal governments, our provider communities, the board, our regional entities. This is something that cannot be done alone, and we all need to contribute to the solutions for a problem this complex and wide sweeping. The one that the board is really going to have a lot of say in, and we shared last meeting and then also at the committee level, is improving access to data on HMIS. So we have a couple of interested funders who are wanting to explore and evaluate our current vendor and the systems of HMIS, and really trying to make it useful. And Solari has been an excellent implementer and have identified and documented some ways in which they're kind of hamstrung. And so this is an opportunity for the board as well as our partnering agencies to support the HMIS team in moving forward and getting data that we need to inform decisions. This does not just mean HMIS. This is all sorts of different data sources, but HMIS is one example. All right, next slide, please. The second one is really focused on increasing our temporary and permanent housing. So the board is really going to be involved in both that and then also enhancing the coordinated entry system. As you all are aware, we're going through the process right now through the support of the city of Phoenix to do an evaluation that's led by the Continuum of our coordinated entry system. And it has dollars for implementation. So we're hoping that the questions that it raises being guided by the coordinated entry subcommittee and this board, that we're really able to not only identify the strengths and some of the areas for improvement, but be able to implement and act on some of those things. So these are areas in which the board will be very involved with ongoing. Next slide, please. And lastly is really just the diverse partnerships. One of the aspects of this in the bolded one is focused on street outreach. We have, and if you haven't seen, MAG staff has reached out to the original members of the outreach collaborative that was ongoing, and we're starting that back up again to make sure that there's a voice for outreach providers and to really inform outreach processes going forward. We want to make sure there's regional coverage. We want to make sure that whoever is experiencing homelessness on the streets has access to services. And so that's really what that is. That is not, that's something that I think we all are on board with and in favor of. And so we see the board playing a big role in that ongoing. Next slide, please. And so the overall time frame that we're looking at right now, next slide, Katie, is really October was a time where we were reviewing this. We reviewed it with you all, solicited feedback. We had a lot of different feedback and made a lot of different changes. In November, it's really for action. And so the management committee, as you can see on this slide, approved it. And now it is time really for the COC board to vote for approval on this as well. In December, we have a special session actually next week with regional council to vote on this. And then ongoing, it's really where the work begins, right? It's the implementation of this plan. And I guess begins is not the right word, because many of the things within this plan have already begun, and there is a lot of action that is already being taken in line with this. It hasn't been one of those plans. It's like, hold on, wait, before we do the ribbon cutting, before we act. There's been a lot of actions, a ton of actions. I hope that if you've been able to take some time to read through the plan, which is attached to the board packet, and it was last month as well, you can see some of the examples as well. But a lot of great feedback and work. And I just wanted to personally thank the board for the feedback that you all have provided throughout, whether it's individual phone calls or group sessions or meetings. There's been a lot of opportunities, and just wanted to thank you all for that. Next slide, please. All right, and so here's my information in Amy's as always, so you can reach out to us anytime afterwards. But what we're gonna do as a part of this is first open it up for discussion and questions. We've gone over this information quite a bit, so I hope that you could still view it with some fresh eyes and excitement as what we have. But if not, let us know if you have any questions right now, and we can discuss this a little bit. And then the plan would be for this board to take action on recommending approval of this plan. So I guess right now we'll open it up. Any questions, discussion points that the board would like to raise? Chris?
Yes, thank you. It was a 5-year plan, very well detailed. So I first want to thank MAG, all their leadership on this and facilitation. That's quite an undertaking that's been needed for years. And I think we're all probably in agreement with that. And I think we all want to make sure it's not just a plan that sits on a shelf, you know, and a plan to plan. We talked, I know I've articulated the need for action and implementation as part of this plan and the continuity of it. To that extent, my question is, you know, the plan articulates 770 units of temporary housing and 1,250 units of permanent support. What's the benchmark? What's the baseline? I don't see that in here. I've asked that before about what's the number, at what date was that number calculated? So people are getting credit post that versus, and then we're going to have like a 5-year tally board with the commitment letters on pledges versus actual units being produced and whatnot. I think it's very important in order to do that is have that snapshot, if you will, of these units at what point in time, so we know what came online after that. Give all the credit to those who did it and the geographic locations and whatnot. It just, these numbers have always been floating around a lot, and who's ever the keeper of the number, I think it's imperative that it kind of gets documented here and measured against itself, regardless if it's accurate or not. What is that number and what was it comprised of at that particular point in time? I don't know if it's at an appendix or something that you want to do from a further reporting or online presentation of it.
No, thank you, Madam Chair and Chris. I appreciate the question, and we have always appreciated the comments that you brought up, especially around this item. And so I'll talk a little bit to that. So one is, this is based on the 2020 housing inventory charts that came out. That was the baseline. And as we go forward, the plan is actually to produce a couple of different things going forward. So one is next week at the Regional Council, there will be a brief discussion around cost for each of the action items, what is partially funded and what is fully funded. And that would get down into some of the numbers specific to the temporary and permanent housing. And then ongoing, as a part of this plan, the plan is to review this quarterly and to update the projection of numbers 25% each year. As a part of that tracking our progress, it will be a part of it that we are identifying any of the new units that have come on based on the time frame that we're looking at. We're hoping to document that in the hand-up tool, as well as an ongoing dashboard, which will focus purely on the implementation of this plan. We want to not only track the progress, but call out the successes of those communities that are implementing these things. So that is a part of the ongoing tracking. It is not necessarily a part of this document. We're still working on wrapping up, getting some figures from people about what is being implemented and has been approved. Missing a few, but we're getting quite close. So I hope that answers your question, Chris.
Yes, it does. And the other part of that question is Appendix B speaks to community highlights, and it's really hard to tell of those. Are they before the number, already in the number?
Sure.
And I know one we're called out with, we're partnering with Youngtown and Surprise for an iHelp. We just went to council last week and got that approval. They already had an iHelp, so are their numbers in it? Our number is going to be added and towards the cause. So that's why I say, I know you try to really show the collaboration, and I know you pulled it out and put it in an appendix on what was ongoing, but I just want to be clear. So we're actually in the needle. Here's where we were. Here's our counting towards it. Here's what was already in the number. And then I didn't know how and if, and realize it's not this document, maybe afterwards when you're tracking it is, we have losses too, right? We lose units. So are we fixated on a fixed number to add, knowing we can't really necessarily control the others, having just gone through the rank and review where we're pitting projects against each other and a net add versus a keep even. So part of this is just me learning some of this new stuff and our role here and how it fits into this regional vision of a document we have in front of us.
Absolutely. Yeah, Madam Chair and Chris, absolutely. And I think we're learning along the way as well. And the goal really is to track where we're at, because the current stock, we've looked at the data and understand what our current stock produces in terms of who can go through the system and kind of engage with permanent housing, who can stay off of the street and get into shelter. And so it will all be, it has to increase from there. And if it doesn't, obviously we'll see the impact of that on our ongoing increases in homelessness in our community. Well, but thank you for the question, Chris. Any other questions or comments? All right, I don't see any. Katie, I don't know if there are any from the public, but I'll pass it back to you anyway as it goes for action.
Madam Chair, do you want to ask for a motion?
I most certainly do. So again, before I do that, again, just on behalf of the board and at least from my vantage point in the community, TJ and MAG staff, thank you for shepherding this through. I know this was not an easy task, especially when we got started with all of the questions from those of us who do something in this area of work, with just wanting to understand where our place was and all the different parts, and how local governments are involved, how nonprofit providers are involved, how the states and the counties are involved. I mean, it was just a lot to really take in and put some structure around. And then all of the outreach that you guys did from, I mean, I know you did 25 to 30 individual meetings, let alone all the focus groups and the strategy sessions and the different committees. I mean, this was an immense amount of work, and I think it's turned into a very strategic and thoughtful and feasible piece of work that's really going to, as Chris said, move the needle in our community. So just thank you so much. I'm really looking forward to getting onto this new phase of implementation. So thanks to everyone who had any part of this, board members, staff members, community members, nonprofit providers, everybody involved. Thank you for getting us to this point. So with that, do I have a motion to approve the Pathways Home, a regional homeless action plan for local and tribal governments?
This is Chris, I'll move approval.
Thank you, Chris. Can I get a second?
This is Joan, I'll second.
Thank you, Joan. So we have a motion from Chris and a second from Joan. Is there any discussion of the motion? All right, seeing none, I will now ask Katie to proceed with the roll call vote. Please indicate clearly how you vote, stating nay or yay after your name is called.
I'm hoping for some creativity. Chair Balch.
A very enthusiastic yay.
Awesome. Eric Cole.
Madam Chair, you took mine. I was going to say enthusiastically, yay.
Elizabeth DaCosta.
Still working on my creativity, yay.
Marshall Franklin.
No creativity this time, just yay.
Tad Gary. Chris Hallett.
Long-awaited participatory yay for this one, yes.
Joan Service.
Yeehaw.
Yay. Charles Sullivan.
Nobody has used I.
Jackie Taylor.
Yay.
The motion passes unanimously. Back to you, Chair.
Awesome. Thank you, everyone. And just thank you again, everyone. A million thank yous to everyone who had any part in this at all. Now we will move on to the next agenda item. Ms. Gentry will provide a presentation on the proposed changes to the Continuum of Care Charter and offer those changes for approval. Katie.
Sorry. All right, Madam Chair, members of the committee, I just want to first say a big thank you to those who joined me for a series of charter work group. I know you guys have spent quite a few hours working on this and working through this and moving from a 66-page charter to a more refined, more action-driven charter. I want to just give like an overview of where we've been and kind of the changes that are happening. But also in your agenda packet, there was both the red line charter and the clean charter. So if you wanted to review in more detail, that is available to you. So first things first, in the introduction of the charter, we updated the organization count to reflect current awards. So in that first introduction, it said that we used to fund 46, and now we've moved down to serving 31 different programs. We updated the vision, mission, and values as you all approved in May of 2021. We removed the guiding principles section as we felt the vision, mission, and values really replaced that and was a better speaking point for it. We updated the COC governance structure to include a 6th lateral group. So we added the lived experience subcommittee, which is equivalent to your other 5 committees, being the committee, ESG, coordinated entry, data subcommittee, and the committee itself. We updated work groups to be time limited, goal driven, and data driven rather than just kind of on into infinity. And then we also summarized the COC duties to include the duties designated in the Hearth Act rather than outlining every single line item of the Hearth Act. So really, we just said we follow the Hearth Act, which is in line with a lot of other charters of other COCs. And if you have any questions throughout, feel free to stop me. If not, I'll kind of just keep going through. So across the COC charter, this is something that kind of fell into every different subcommittee. So as I walk through this next set of sections, I'll walk you through every COC subcommittee, but wanted to give you kind of a generalized, what did we do with all of our subcommittees? So we updated the meeting section, including open meeting law, to keep consistent language throughout. So we found that the COC board had different language in the committee, even though you all are doing the same thing. And so we just kept consistent language. We updated participation, moving from 4 consecutive absences to 3 with a warning after 2 absences from the either MAG staff or the chair asking you to attend the next meeting. We added code of conduct language across all committees. So this was present in the board language, but not across all of the subcommittees. We added geographic representation, racial diversity, and underrepresented groups to every committee. Previously, this said that we would weigh this in member membership, but this was a board charter work group to really say that we need geographic representation, we need racial diversity, and we need underrepresented groups on all of our committees. And so we added that language to be that at least one member needed to be present for each of these things. We updated the co-chair language to have consistency across all committees. Some committees had a chair and vice chair, others had 2 co-chairs. And so we've now stayed consistent to having 2 co-chairs that sub off every 1 year. So you would have 1 co-chair for each serves 2 years, but they alternate every year flipping off. So you have some old, some new, and the old can help train the new. We removed the shared responsibilities section and shifted each of those to each committee's roles and responsibilities. So rather than having a shared responsibility section that said 3 committees are going to do this, we added in each of those 3 committees what they were responsible for, because we felt like it was kind of just falling off of the shared responsibilities. And then lastly, we added ad hoc working groups to each committee's roles and responsibilities. So this is really empowering every group to develop an ad hoc working group if they need it and have it be time limited, data driven, and goal driven. Oh, I think I skipped one. Okay. So the COC board, we refined the overview and relationship to be more broad focused, including the relationship to the COC and the region. Before it was very narrow to just how are you overseeing the COC, and really you all felt that you were more of a rubber stamp kind of just approving what was happening in the COC. And this made it more broad focused to be more big C instead of just little c on the continuum of care. We refined the community seat as far as membership goes to include specific representatives that the board wanted to include or could include. We updated the term limits to be 3 years with the ability to reapply rather than automatically renew your seat. So at the end of 3 years, you would be reapplying for your seat and you would be competing against anybody else who would be applying for your seat rather than just an automatic renewal of your seat after 3 years. We updated the membership selection section so that we have a formation of a membership work group with that membership work group serving for 1 year. So they would serve throughout that full year. If you only do membership recruitment once, then they would just meet that one time. But if you decided to do membership recruitment again, that same membership work group would re-meet and reconvene to review applications. And then we updated your roles and responsibilities to include more action-oriented and broader focus, which is right here. So we made strategic planning and policy decisions for COC funded providers and agencies. We added setting strategic priorities for the region and making regional policy recommendations to local leaders, regional councils, state leaders, and additional partners. Promote understanding in the community and educate elected officials, agency heads, and community leaders regarding policies and actions to prevent and end homelessness. We added convening diverse stakeholders that address and are impacted by homelessness. And finally, we added developing an annual strategic plan. As far as the collaborative applicants, this would be MAG's roles and responsibilities. We added the following additions. Coordinate the review of the governance charter. So the governance charter really falls into the board's purview, but MAG staff will be coordinating the review, making sure it happens on an annual basis. Onboarding and introducing new members and chairs across all committees. So when we add 10 new committee members, we will be doing an onboarding session with them, having them understand what their responsibility is as part of the committee, as well as with their chairs, the new chairs. And then communicating COC funded program performance to the COC board in order for the COC board to take action. Kind of across all of these, we updated the language to streamline action steps and make them action oriented. So every action step starts with a verb instead of passive language that has been used in the past. Keep going. So as far as the COC committee goes, we updated the membership selection based on the current process as well as the membership work groups process. So it used to be kind of a back and forth, and for the last few years, we've been having it be pretty streamlined of just applying for the committee or the board directly. So we updated that language to reflect it. And then for their roles and responsibilities, we updated to make them more action-oriented. We strengthened the language, making input go straight to the COC board rather than to COC staff and then to the board. We shifted responsibility to the COC committee for the community best practices, the coordination of the system performance measures, and best practices based off of those system performance measures and the evaluation tools used within the COC system. We added reviewing and providing feedback to the data subcommittee on the system flow dashboard. And we added review and provide feedback to the ESG subcommittee on the standards for administering assistance. I see heads nodding, so I'm going to keep going. As far as the coordinated entry subcommittee goes, we refined the overview to include the policies and the operations of the coordinated entry subcommittee. We refined the grievance policy, voting to only have coordinated entry leads recuse themselves when the grievance applies to them versus before they had to recuse themselves every single time a grievance happened. We updated the membership to include a person with lived experience. We updated the proxy to include both coordinated entry leads and the HMIS representative versus before it was only the coordinated entry leads. And then we strengthened and streamlined the language within the roles and responsibilities. The data subcommittee is pretty similar. So we refined the membership process to follow the membership recruitment in place before it kind of went up to the board and then back down to the data subcommittee, and that was the only group doing that. And so this just mirrors all the other membership process of applying for the membership and then having the subcommittee review those potential new members. We updated the membership to include a person with lived experience. We included proxy for an HMIS representative, and then we updated the roles and responsibilities to include the review of the system flow dashboard, and then additional data requested by the board and support technical assistance plan related to data. So if MAG was going to implement a technical assistance plan and some of that would be like we're doing training through HMIS, then we would ask the data subcommittee to step in and assist if that applies. As Rachel mentioned earlier, we are still in the process of finishing building out the ESG subcommittee. So for now, we've refined membership to include the city of Tempe. We will be updating the roles and responsibilities in the coming months, and we removed the written standards from the charter itself and shifted that to the ESG subcommittee to review, as they are the ones who are implementing those written standards in their contracts. As I mentioned earlier, we have added a lived experience subcommittee. So this subcommittee really came out of the racial equity plan, feeling like there needs to be a place for people with lived experience to give input and feedback on how our system is running. And it mirrors the same structure as all of our other committees. So it has meetings, participation, code of conduct, a membership structure, membership selection, co-chairs, and roles and responsibilities. The only change with the lived experience from the rest of our subcommittees is accessibility in applying both online and through a paper application. So we will have those applications available with nonprofit providers to be able to apply both on paper, and you can always request a paper application rather than just having an online application. The rank and review subcommittee, we updated language to be required interviews, which follows our current process. We moved the review, rank, and reallocation process right below the subcommittee in the charter. And then we just updated the language as to reflect what you all approved in April of 2021 and inserted that into the charter based off of what you have already approved. And then kind of document changes, as I mentioned this, we removed the ESG and COC written standards as it's a responsibility of the ESG subcommittee. We removed the community best practices as it is a responsibility of the COC committee and felt it didn't really need to reside in the charter. And then we updated the formatting. So just making all the lines the same, bullets the same, all of that. Any questions? I know I kind of went through that pretty quickly.
great work. That's what I have to say. I can only imagine the hours that went into updating this. So just kudos to everyone that had a part in it. It looks really, really great, Katie.
Thank you, Jackie. Anyone else have, that was a lot of information summarized very well. I know that the charter, this has been a long time coming that we've been talking about this, and the charter subcommittee had at least 3 meetings, and maybe there were 4. I think there were 3, and did a lot of great work reviewing in between. So thank you to all the members of the charter committee. Any other comments, questions from board members or other folks? Okay, thank you so much for the great summary as well, Katie, and for the red line document. I think that's really helpful in terms of anyone who really wants to dive into it and see where we've been and where we're going. I'm really personally proud of this work for our community. I think it really reflects where we were starting, where we wanted to go when we started this process. I feel my time might be off, but it feels like maybe a year ago or so, maybe not that long ago, when we started with the mission, vision, and values, really propelling ourselves forward in terms of being a board and committees of the board that were signing off on things and approving things, to folks who are really sharing their knowledge and experience with the world in a way that moves the needle and changes policy and leading others to help end this tremendous problem that we have in our valley and our country. So I think this is a major step in the right direction. I'm super happy to see it. Happy to be participating in it with everyone who is in our valley doing this work. So thank you, thank you, thank you. Any other comments from the board before I ask for a motion?
Madam Chair.
Yes, Eric.
It's Eric. I know we don't have any questions on the table, which is I get, but I just wanted to add my voice to thanking Katie and the staff, but also just the group that worked on this. We did consider a number of different well, we worked pretty hard on it and spent a bunch of time on it. So I guess I'm offering, if folks do have questions or thoughts as they have a chance to digest it or going forward, I for one would be happy to kind of talk through what our rationale was. I know, this virtual setting is not super conducive. Katie did a fantastic job going through everything, but it's a lot. So anyway, just thank you all, but also offering to kind of help clarify if that's needed now or down the road. Thank you.
Thanks, Eric. Others? Anyone else? I know, Chris, I'll just call you out and say it was super helpful to have you participating in this, because you have a new look at something that some of us have been looking at for years, and it's hard to see through what you're really used to. At least I find that for myself. So just asking the questions and seeking understanding really helped, really added some vibrancy to this discussion and made us all think further, and I think really helped propel us along. So thank you for that. Okay, so may I have a motion I should be more specific. Can I get a motion to approve the changes of the Continuum of Care Charter?
I would so move, Madam Chair.
Thank you, Eric. So we have a first.
Second, this is Jackie.
Jackie, thank you so much, Jackie. So we have a first from Eric, a second from Jackie. Is there any further discussion? All right, seeing none, I will ask Katie to please proceed with the roll call vote. As a reminder, please state clearly your yay, nay, or something more creative when your name is called.
Chair Ryan Balch.
Yay, yay, yay.
Eric Cole.
Aye.
Elizabeth DaCosta.
Yay.
Michelle Franklin,
Yay. Yay.
Chris Hallett,
Yay.
Joan Service,
Yay.
Charles Sullivan,
Aye.
Jackie Taylor.
Yay.
The motion passes unanimously.
Thank you very much, Katie, and everyone. I feel like we're making like a lot of progress during this meeting. All this work that we've been doing over a lot of time, we're like signing off on things left and right today. So it is a good day. So let's move on to the next agenda item. With the approval of the charter, we will now be opening up membership for the board. Hallelujah. Board membership will open from now until the end of December. Do we have any volunteers interested in participating in the board membership work group? The work group will meet the beginning of January and bring forward recommendations to the full board at our next meeting. All right, do I have any volunteers? How many people do we need, Katie?
3 to 4 would be ideal. I see Jackie, you're raising your hand.
Okay, Jackie, thank you. Chris, thank you. I am happy to serve, but want to give other people, as many other people, the opportunity as possible. So just use me if you need me. I think I saw a hand from Liz, possibly.
Yes, I think Liz.
Okay. All right. We have some other members that aren't here today too. So staff, maybe you can reach out to them.
Yes, ma'am.
All right, and we will go from there. So thank you to Jackie, Eric. Was it Eric? Was Eric there? No, Eric. Jackie, Chris. Liz. Perfect. All right, thank you everyone. And it's really awesome. Katie will send out a follow-up email to schedule meetings and to seek additional volunteers. And I'm so glad we're finally at that point where we get to add new members, and with our new charter information guiding that process. So this is great. All right, we will move on to the next agenda item. TJ with MAB will review the proposed system flow dashboard. TJ.
Hi, everybody. Madam Chair, members of the board. Katie, do you mind pulling that up for us? Okay. All right, awesome. So what you're seeing in front of you is based on feedback that we received from you all last month. Last month, we went through that the system flow dashboard was approved. We shared a process and data points with you all that you approved. And this is the first draft of that with real data from July to September. And so what you'll see through here and what we're looking for is one, for you all to just take a peek at it, look at it. It is now on the website, so you'll have time to mull over this after the meeting as well. What we're looking for is this is a draft, really wanting this to be as useful as possible to you and the public, right? So with this data here, please note down your feedback and make sure to send that to us so that we can make these updates. What I'll do right now is I'm just going to walk through this infographic basically to outline all of the things that are incorporated in this. And then we'll take some time for questions. And also, honestly, feel free to interrupt me in the middle of this to talk about things that you may have questions about or if there's a concern. So first of all, you'll note that the date is on the top of this, and we really start with total active homeless numbers. So this is straight off the dashboard. We try to provide both a definition of what actively homeless means in layman's terms. We're not getting technical here. This is for the general public, really, and for us to look at. It's not for us to really get into the technicalities of HMIS. So you'll see on the top of that, actively homeless households, that's the definition. And then right after that is a description of what we saw and some precursors and information built on the feedback from our teams as to why that number is what it is. So I will just say that these are real numbers. So you can see from September of last year to September of this year, we have seen a pretty dramatic increase. And you'll see here in our descriptions, I won't read through all of these, but that COVID had a strange effect on our community, especially in our ability to track data through outreach and shelter due to reduced staff capacity. You'll see right below that, new to the system. And then right below that, you'll see our housing placements. And so, you know, again, based on your feedback, these were things that we wanted to see not only just as they are, but longitudinally, so that we can look at it. Are these increasing? Are these decreasing? If they are increasing or decreasing, what is causing that? To at least some degree be able to explain what is happening. Can you go down to the next page, Katie? All right, and then so now you'll get to a demographics page. So this page really focuses on who makes up our actively homeless population. And so you'll see at the top, you see gender, right below that, you see race and ethnicity. And right below that, you'll see some of our age groups. One of my favorite parts about this, which I think will be really useful to all of you, is this little graphic at the bottom. Katie, could I ask that you try to zoom in on this little infographic part at the bottom? The comparison to Maricopa County. So one thing that we heard a lot of people interested in is really understanding what we're seeing in HMIS versus our community data through the census. So in the yellow, or that sort of orangey yellow, you'll see the HMIS data, and in the blue, you'll see the census data. So if you look on the left side, you can see that our HMIS data shows many more males in our system than would be standard, like if we were comparing across the census. If you're looking at race, 27% of the people on our active list are Black, whereas 6 are Black in our census data, right? And so we wanted to show this data across gender, race, ethnicity, and age to really show the differences of who is experiencing homeless in our community and how does that differ to our general population. So I hope this can be truly useful to you and to the general public as we're really looking at the disproportionate impacts of homelessness on our community members. Next one here. And so this slide is special population. So this is really similar to what you've seen previously on the point in time reports. We wanted to highlight specific populations based on the feedback of this group and others. So we have older adults, youth age 18 to 24, veterans, and our chronically homeless. And this way you can see over the past several months, what is it that we're looking at? What are there increases? Are there decreases? And as you can see, both almost all of our populations are seeing pretty dramatic increases. The least of these is veterans, but we're still seeing veterans as at a high number. But as you can see with older adults, youth, and chronically homeless, we've seen a pretty steady curve upwards with them, slight going down over the last month. All right, next slide. And so now one thing that was really important that we heard from you all is that we want to really understand how, and this one in particular is useful for the board, and we're looking for a lot of feedback here. So this is the system performance measure. So Solari had previously been presenting to the board quarterly on how our community is doing on our system performance measures as a whole. And rather than kind of separating that and having a presentation on system performance measures and having the synthesis, we thought it would be really useful to combine them to show you here. Let's just take the reduced length of time homeless on the top left, what this is showing. So the 102 days is showing what our average length of time homeless is. On just to the right of that, you'll see 2020. So what was it in 2020? In 2020, it was 103. So we're seeing a slight reduction from the previous year. What was it last quarter? Last quarter was 106. So we're seeing a slight reduction in what it was from last quarter as well. Our goal is 98. So we're not quite to our goal, but we are trending in the right direction. So that's why you'll see a little thumbs up here. The thumbs up is indicative of we're trending in the right direction, not necessarily there yet. And you'll see the same thing for each of them. You'll see last year's 2020 system performance measures where we were at. You'll see last quarter to indicate kind of a more recent comparison. And then you'll see our goal, which is based on our NOFA and what we're really, or NOFO, what we're looking for through our goals. So again, would love your feedback on this. Some feedback that we're kind of going around in our heads is, should we just put the thumbs up if we're meeting the goal versus trending? Should we reduce the number of data in here and just kind of simplify this a bit? But we wanted to make sure that it was inclusive of enough things to be really useful to you all. But this is a really exciting thing to really be showing as our community. We want to be transparent. We don't have anything to hide. We're trying to improve. And the first place to improve is by being transparent. The next part is a snapshot of clients served by program. So in HMIS, you see each program is designated by a different type. So you'll have emergency shelters, transitional housing, safe haven, rapid rehousing, permanent supportive housing, and other permanent housing. These also match what you see on the point in time, these types. And so you'll just see the number. We wanted to share with you by program type if we're seeing substantial increases or decreases in any of these in particular that could call something into question. Like, for example, if we saw, like in this, right, why is it that we saw in July, there was roughly 2,500 in emergency shelter, in August, there was 2,000, and then in September, it was back up to 2,500, right? These things are to help us basically have data to question. And then just to the right of that, you'll see that how many new projects were implemented in HMIS in particular. You'll see the date right below it. So this was July through September. There were 8 emergency shelter programs added, 1 other permanent housing, and 2 rapid programs that were added. Solari has a lot of information that they've input and worked with our MAG regional analytics team to really put into this. So just want to give a shout out to them, but also we really want your honest feedback about this. The last thing we want is something that is pretty and useless. We want something that is useful to you, and also that we think would be beneficial to the public and news reporters who are trying to understand what's happening in our system as it is right now. So with that, I will pass it back to you, Madam Chair. If there's any items right now for discussion or questions, feel free to bring them up. But I know, similar to the governance, this is a lot of information. And so if you need to take some time with it, if you want to just look at it, if you want to give it, like one thing that I do is give it to somebody who is not familiar with the homeless system, be like, hey, does this mean anything to you? And really be able to distill this down to something that's useful and simple. So yeah, back to you, Madam Chair.
Gosh, thank you so much, TJ. I mean, my first reaction is wow. I love the way it looks. There's a ton of information on it. I personally want to take a lot more time and dig into it. But I love your idea about giving it to people who, don't have experience with these particular indicators or our system to see what kind of questions we get. It even makes me think we might want to give a draft to some of our media entities that we trust in the community and say, this is a first draft. We want to know, like, what does this mean to you? What kinds of questions do you have? That would be neat if we could do that, because it's hard for me to imagine what something like this looks like to someone not doing, without some exposure to this topic. I can't even imagine, but I love the look and feel of it. Others, anyone have comments, questions? Liz.
Yeah, it's fantastic. Just such awesome work. I appreciate the system performance measures so much, and just some feedback. I like the thumbs up when we're trending towards the goal. But I do think we need to do some work as a board to identify what our plan is for trying to help achieve the goal. So what do we do with the data, right? And then my other comment is on that first page, the significant reduction in like new individuals experiencing homelessness. I wonder if we can just try to articulate that a little bit more. It was difficult for me to kind of in the language like wrap my mind around how that was the reason why we saw such a significant decrease. And so I just wonder for the layperson what their experience would be. And then my final feedback is just the goals, the regional goals, where we talk about like, you know, our goal to increase the number of permanent support housing units. I think just like you guys have done such a fantastic job. If we have anywhere on there, like the number of shelter beds we currently have and like what the regional goal is, I think that's really going to help tell the story for why we see such a significant amount of individuals who are experiencing homelessness and what that lack of resource is and the work that we're doing to try to get there. But at the end of the day, just such a fantastic job. It's so exciting to see. I'm just like super proud of you all. I'm glad to be a part of it.
Thank you, Liz. Yeah.
Madam Chair, my comments kind of along the lines of what Liz said. It's Eric. And I agree, like having the systems performance measures out there constantly, continuously talked about, so important. This is something we've needed to do across the systems for a long time. TJ, I might consider some sort of an icon. The thumbs up, thumbs down is really simple and that's cool. But I do wonder if there's something that we could use that would have some shades, you know, that like would indicate slight increase or decrease or trending. And I don't exactly know what that would be, because I did look at, you know, that one of them in thumbs up and I was like, yes. And then it was like, oh, it's just one, you know, it was like 1 percentage point. So I don't have a specific suggestion, but it might be good to have something that, you know, provides a little bit of a gradient there. But overall, this is fantastic.
Thank you. And Madam Chair and Eric, so I think your head is in the same space as ours, is trying to figure out how to simply display that level of variance of, and perhaps it is just maybe providing a little bit more space and saying like trending up, trending down, met goal, not met goal, or something like that, and maybe color code that with like a green, yellow, red or something. But yeah, I agree with you that we would definitely take any feedback that you all have on if you've seen anything else that you've appreciated that shows some sense of indication of progress.
I would ask just a question, TJ, or anyone who can answer this question. Besides us, have we put this by any other populations or groups as of yet?
So we have shared this some internally, and we have it on the list for our Lived Experience Council. I think we wanted to, in particular, follow up with the board almost as one of our first items of, as since we got the data points approved by you all last time, we really see this as an iterative thing that it is growing and can adjust based on the needs. But getting your feedback first and then going through one of the points of our process that we are really excited about is that we, in the kind of months leading up to when this is shared, soliciting feedback and questions from our core groups that are associated with the Continuum to make sure that we can try to address those and incorporate that information. But I think that's a good point. And if there's any other suggestions from the board of how you all envision, even how, like to Liz's point, the way that things are worded, perhaps it does not resonate with a broader scope. We'll try to, our goal is to send it through our communications team, who does a really great job of kind of outlining this. For this one, we really just drafted language to have placeholders for it. But ongoing, I think we'll have a little bit better there. But yeah, any other suggestions from the board would be greatly appreciated.
I would love to see a way that you could get it by some very specific population, decision, like state and local decision makers. How would they view this? How would this information being publicized for everyone to see, how might that be read in terms of our states or our municipalities or our counties' ability to, bring resources to the table, to talk about the work we do. I would like to get different perspectives view on it and just see what people pick up on. So again, I'm totally comfortable with that iterative process. And I want to make sure I see that this item is we're voting on it today. So what exactly, I guess, are we voting on? Are we voting on this is the first draft? Are we voting on, yes, you're moving in the right direction, but you can still, as you get feedback, you can modify? Are we going to vote on this every quarter? What's the goal?
Yeah, Madam Chair and members of the board, great question. I think what we're voting on is really just the framework. So does this work to really, we shared the process last time. So does this look good enough to be filled in for the next quarter without any additions? And if there are additions, then just letting us know and we can add them. So I think it's not necessarily putting a final permanent marker on this to say no more changes, this is approved as is. I think it's more of, does this look sufficient? Does it incorporate enough at this point to be the first iteration of this to go out? Which just to clarify for the board, the time frame for the next version of this would be February. So that would incorporate the data between September and through December. That way the data is finalized in January and then gives a month for feedback, questions, and additions to the form. And then that would be updated. That is about as fast as I think we can go. And it also is a couple months quicker than we would do the annual PIT report, right? The PIT report, we do the PIT January and the final report's not done until April and sometimes May. And so we're trying to do this as fast as possible, but we want to make sure it's inclusive of the thing. So just in summary of all of what I just said, I think what we're looking for the board to take action on is, does this really meet your expectations based on the feedback that you provided last time enough to really proceed with the process and filling out this data more thoroughly for the February time at which we'll produce the next version?
Okay, thanks, TJ. I can only speak for myself, and then I'm going to specifically ask for from some other board members' perspectives. But for me, it exceeds my expectations in terms of what it looks and feels like and the level of information that you're able to provide in this document. I think it's fantastic. I love. This is one of those moments where I feel like every now and then, you're on the internet looking for something that you're working on and you want to see what other communities are doing and you go, gosh, that's so awesome what that community has. Why don't we have something like this? Or I wish our community has something like this. I mean, this is one of those things, like, people are going to look at this and say, wow, look at all the data Maricopa County has and look how they're sharing it. I think this is going to be a point of pride for sure. And not only just a point of pride, but it's really going to be able to help us drive our work very, very purposefully. So I'm super happy about it. I know that as I start to share it with my constituency, which is going to be, for me, it's going to be, city managers and council people, not that I'm seeking to do that right away, but the people who are going to look at it from my perspective are going to say, oh, this is how this is going to be perceived. And then I'm going to provide you guys feedback on that. And I feel like I'm ready to do that. So from my perspective, I think this first one will be a great way to get reactions and see how other people react to it. And then I would like to be able to provide you guys that feedback back. I'd like to know how other board members in the environment that they're in, if they feel ready to take this forward and what do they anticipate coming from that.
This is Liz. I just agree with Ryan. I think it's a really good starting point for us to have conversation, and I think it's ready to go.
Thanks, Liz.
This is Jackie. I feel the same. In fact, as you were walking through some of the data points, as a provider, I started looking at our own internal statistics and doing some internal comparison. So I think it's a great tool. I really like Eric's suggestion of kind of color coding. I like the thumbs up, thumbs down, but maybe a color coding to indicate how close we are might be a helpful addition, but awesome work.
Others?
And this is Marshall. Ditto what everyone has said. This is great. And I look forward to being able to share this with our management team and our policymakers. So thank you, everyone on MAG, TJ, and everyone. Thank you.
Madam Chair, if I may, and members of the board, I did want to give a special shout out to both MAG's internal regional analytics team. Maggie is on. She put a ton of work into the visualization of this, and it's incredible work. And she's done the same with many of the PIT reports, which you probably have seen and reference a lot, like myself. And then definitely to Ty and Stephanie and Curtis, and I'm sure I'm missing several people on the Solari HMIS team, but have put in a ton of work on all of these things, and just wanted to really thank them for being the backbone behind types of things like this.
Thank you, TJ. Yes, kudos to you all. It looks great. The information's amazing. Thank you for all your brain power and talent. Yeah. I don't know how to make those cute little thingies anymore without just raising my hand. So,
Hey, it's Eric. Following up on that, TJ and team. You know, I love data visualization. It's one of my favorite things. To the extent you could generate some of these things in social media-able formats, I think it's always good to kind of have that undercurrent out there of real data. And I think the way you've presented this makes it accessible to regular folks, and so I think it'd be cool to have just snippets that we could share through our various accounts.
all right. Thank you everyone for your comments. Thank you everyone for your hard work. So with that, knowing that this is an iterative process, that what we're voting for today is to use this first draft to present to our constituencies and to get some feedback from them. And I am what's the word I'm looking for? I'm asking, I guess, for you all. I'm enthusiastically asking. There's a word I'm looking for that I'm not pinpointing right now, but please take that feedback and get it back to MAG staff so they can work with it and mull it over and use their talent to make this the very best that this can be. So with that knowledge, I would ask for a motion to approve this first and very exciting quarterly dashboard.
So moved. This is Chris.
Thanks, Chris. Looking for a second.
This is Liz. I second.
Thanks so much, Liz. So we have a first from Chris and a second from Liz. Is there any additional discussion on this motion? All right, seeing none, I will ask Katie to please proceed with the roll call. As always, please indicate your vote clearly with a yay or a nay after your name is called.
Chair Balch.
Yes.
Eric Cole.
Aye.
Elizabeth DaCosta.
Yay.
Rochelle Franklin.
Aye.
Chris Hallett.
Yay.
Joan Service.
Yay.
Charles Sullivan.
Yay.
Jackie Taylor.
Yay.
The motion passes unanimously.
All right. Thank you. So many exciting things happening today. All right. Let's move on to the next agenda item. Let's see. So Stephanie Crum, HMIS Manager with Solari Crisis and Human Services, will provide a demonstration of the Racial Equity Provider Toolkit and answer any questions. Hi, Stephanie.
Hello. Hi, Madam Chair, members of the board. Thank you for having me and presenting this toolkit today. So yes, as we all know, and as DJ was pointing out on the last dashboard, there are a lot of inequities in our community, especially regarding folks who are Black, Native, Indigenous. We really were working as a COC, brought in some consultants with race equity partners, Donald Whitehead, Jeff Olivet, some of you may have gotten to work with them, and really wanted to look at what we could do as a community to start addressing these inequities. And one of the things that came out of that was this race equity toolkit. So one way that this toolkit really works is by taking that data that we have on the race equity dashboard, which does include the census data, like TJ was saying, and really pairing it with an ART report out of HMIS that comes out on a provider level. So each individual provider and agency would be able to run this race equity ART report and then use that in conjunction with the dashboard to really look at how their agency is doing both across Maricopa County in comparison to the census data as well. So the dashboard really, when you pull it up, you're really going to be able to see the percent of people identifying as any given race living in Maricopa County, the percentage of the people who are also living in poverty in Maricopa County. You're going to be also able to see emergency shelter use broken out by both race and ethnicity, as well as rapid rehousing, permanent supportive housing programs as well. As you see on this dashboard, there are some pretty large disparities. As you scroll down to Black, African American, you can see that less than 6% of Maricopa County's population is Black, yet nearly 30% are represented in our homeless community. Yeah, these are systemic issues that this toolkit is looking to start addressing. As you pull the ART report, you're also going to be able to see, each provider will be able to see the race and ethnicity breakdown of the clients in their programs, the primary reasons that those clients for homelessness broken out by the race and ethnicity. They're going to be able to see the length of time that their clients have spent in their program. Also, the exit destinations, where are their clients going, broken out by both race and ethnicity. Each tab in the report is going to be able to show the sum of clients related to what's the title on the sheet, and it lines up directly with the dashboard as well. So for using this data, we really want folks to compare the race ethnicity makeup of their clients to the percentages of those same categories across Maricopa County. We really want folks to compare the race ethnicity makeup of their clients compared to any other corresponding programs on the dashboard. Hold on one second, sorry. Oh, the joys of working from home. I'm sorry, we'll have to work through this. We really want folks to look at comparing exit destinations. We really want folks to look for trends, looking at measures, looking at what they're doing well and what they could improve. We really want folks to start looking at this to broaden conversations, to really look at drawing attention to the disparities in their program versus the county, and really empower them on a provider level to start making some changes within their programs. And I think that about wraps it up. The last page of the toolkit is, of course, where the ART report can be found in HMIS. A lot of folks worked on this, not just the HMIS team, but also the 211 team, MAG staff, and a lot of other providers. We really stripped our branding out of this as Solari because we really want this to be a community tool. The next steps for this that we would like to see is I would like to have a training system-wide for providers for showing them how to pull their ART report, having them be able to pull it in real time, and we can troubleshoot any issues or talk about the data in comparison to the dashboard. And really like to empower the race equity leadership group to be able to set benchmarks for providers. I really feel like, yes, this is a systemic issue, but it starts at home and it starts with each individual provider that makes up our system. And this is a great way to empower folks to start doing something now at an agency level. So yes, thank you, Madam Chair. I'll toss it back to you. And then if there's any questions, I do apologize for the dogs barking. If I need to clarify, if you weren't able to hear me, just let me know. And thank you so much for your time today.
All right, thanks so much, Stephanie. This is another exciting thing that's coming to fruition, and all the hard work that I know so many of you all have done on the racial equity work group. This is fantastic. I was going to ask the question about training, but you answered that. But then you moved on to something else that sparked a question for me, which was so the setting of benchmarks, which I think is a fantastic idea. Is that work group also going to put something together, or are there best practices recommendations that we can then provide to providers to say, okay, you're showing this in this area, here are some strategies you could implement to improve that? Will there be a toolkit of sorts for that?
I think that's the end goal. I think Nikki's on here. She could probably speak a little bit more to that, but I think that's the goal. Is we really want the backing of the COC to approve this as a toolkit. And then from there, I think we can really start talking as a community as what those benchmarks might look like and how we would build it out from there.
Okay. For me personally, we operate a couple direct pieces of work. And it'll be great for me to see what the data looks like, but then I'll be like, okay, now what do I do? I'm not an expert in this area. How can I improve what we do to get where we want to go? So I would personally love for people who are experts in that area to provide guidance, to provide strategies, to provide training. So thank you. Other board members.
I just wanted to, Madam Chair, I just wanted to say, thank you, Stephanie and Solari. I know you guys stripped your logo from that, but you guys have done amazing work around this and have just really allowed us to have the data we need, to make data-driven decisions. So yes, Ryan, to all of your questions, we wanted this, we really have funneled this up through the lived experience work group, through the committee, and now to the board. And we would really like the support of the board to move forward on some ways that we can support the providers in our community around this work. And definitely there will be training, and definitely we'll continue to have these discussions and provide some input as to how each organization can work to create a more equitable system.
Thank you, Nikki. That's very helpful. Other members? My apologies, I cannot remember what board members have been a part of this group. Is there anyone that worked on it that has comments? Okay. Well, I think this is another fantastic innovation. Thank you all. I don't think, if I'm reading this correctly, we don't need a vote on that, but I can't wait to see what this brings. Thank you so much. I hope you'll be back again, Stephanie, for an update.
Thank you, Madam Chair. Thank you, members of the board.
Thank you. All right, moving on to the next agenda item, number 10, request for future agenda items. Do board members have any action or discussion item for future meetings? I know I personally feel exhausted from all the work I feel like we accomplished today. All right, seeing none, I know we will pull from our long list of to-dos to put together our next agenda. I guess I would ask the question really quickly, speaking of next agenda to the board, do we usually have a December meeting?
Madam Chair, members of the board, your December meeting typically gets moved to your early January. So currently we have that scheduled for January 10th.
Okay. So
I
that's
will be
already
sending-
scheduled that way?
Yeah, I will be sending out a email after this meeting with a list of your 2022 calendar dates, as well as a hold on your calendar for those dates. I will also be sending out a link to a survey about strategic planning sessions that will happen at the beginning of 2022 after you all recruit new members.
Okay, and that was going to be my next question. Do we plan at the next meeting on voting on new members?
That will ideally happen based on the availability of your membership work group. I'm hoping to have you all meet the beginning of January before that January 10th meeting, and then you would vote January 10th. And we would extend membership at that point, and that will also be when we finalize strategic planning dates based on when those new members, as well as you all, are available and what you hope to accomplish out of your strategic planning.
Okay, great. That gives me and I hope others sort of an idea of what's happening in December, which is always, you know, a little bit of a crazy month for everybody in terms of all of the holiday things that are happening at all of our organizations and meeting, you know, our clients' needs during this cold time and what we can expect in January. So thank you. Anyone think of anything else before we move on? All right, seeing none. Let me see, where am I? All right, comments from the board. For this next agenda item, comments from the board, is there anyone on the board that has any kind of announcement or event they would like to highlight between now and mid-January? All right, I'm not seeing any hands. You know, sometimes it's.
Just want to pick up on this, Chris in Peoria. I mentioned earlier that we just adopted at our council last meeting an iHelp program here in Peoria. So we hope that's immediately underway to contract for them, as well as same agenda. We also approved for 8 beds at Deep Within Recovery, both of which will be part of the coordinated entry and available to the region. And both were done under a cooperative, well, at least the iHelp was done under a cooperative agreement where other municipalities can already just opt in without having to do the procurement, since we did it under a federal funds procurement.
That is awesome, Chris. That's fantastic news. What a great addition in our West Valley. Awesome. Thank you. Anyone else have any awesome? Now that's kind of hard to top. I don't know. Anyone else got anything great going on? All right, well, I know you all have lots of great things going on, but do you have anything you want to announce or can think of at this moment? All right, if not, I will at least say, since I now know that we are not meeting till January, I hope everybody has a very happy holiday and a safe holiday. And thank you to everyone in advance who are doing, you know, all kinds of amazing mensch-like work to assist our community during this time and always. But I know we all put in a lot of extra push at the holiday to take advantage of everything our community can do to leverage our work during this time, and just to really let our unhoused neighbors know that we care about them during this, what looks like a very festive season for everybody else. So that is on my heart to share with you. So thank you, and very happy holidays to everyone. Thank you for a wonderful and tremendous year. And this was I feel like we really tied up a ton of loose ends. So thank you to MAG staff, Solari staff, you know, everybody who does this work for every wonderful thing you have done this year. It's greatly appreciated by this board, and I know by everyone. So thank you. And with nothing further, I adjourn this meeting. Bye, everyone. Happy holidays.
Happy holidays.